Hey everyone, and welcome to our deep dive today. We're going deep into psychotherapy.
Oh, yeah.
But to keep things focused, we're going to zero in on two really interesting approaches.
Okay.
Interpersonal therapies and exposure therapies.
Right.
And for this deep dive,
Mm.
our main source is going to be these two chapters from a psychotherapy textbook.
Gotcha.
So we're going to try to give you like a solid understanding of how these approaches work, like what are the key principles,
Okay.
techniques, and how they can be used to really help people who are, struggling with different psychological issues.
Right.
So,
Makes sense. Psychotherapy is a huge field, so
Yeah.
narrowing it down, this is a good way to go.
exactly. It's like a crash course in two really powerful ways to
Yeah.
help people,
Oh, wow.
overcome psychological distress.
Yeah, I like it.
So let's just jump right in.
Okay.
First up, we've got interpersonal therapies.
All right.
The chapter starts with this story about Marilyn and Ed.
Okay.
And they're this couple who are dealing with depression and just a ton of relationship issues.
Yeah. Marilyn's story, I think, is one that a lot of people can relate to.
Right.
And it just shows how, unresolved conflict in our relationships can really impact our mental health.
Right.
She's trying to be Superwoman, juggling work, family, everything.
It's like a classic example.
Yeah, and Ed's got his own expectations that are, rooted in his own background.
Right.
And they clash with what Marilyn's trying to do, and it just creates this cycle of conflict.
Yeah, it's almost like you can feel the tension just reading about them.
Yeah, exactly.
So how does interpersonal therapy, or IPT,
Right.
actually help a couple like this?
Well, IPT, which, by the way, was developed by Gerald Klerman, and Myrna Weissman focuses on 4 key problem areas:
Okay.
grief, role disputes, role transitions, and interpersonal deficits. I mean, these are all things that pretty much everyone deals with at some point.
Yeah, for sure.
Right. It's just about how do we navigate those ups and downs in our relationships.
Right. Yeah. So IPT, it recognizes these challenges,
Yeah.
but it also seems to place a lot of importance on our current relationships as kind of the key to feeling better. Why is that?
Well, IPT acknowledges that early experiences matter,
Yeah.
but the real focus is on improving your relationships in the here and now. It's kind of like saying, okay, the past happened.
Right.
What can we do today to make things better?
I see. So it's more action-oriented.
Right.
It's like you're taking control in a way.
Exactly. Yeah.
Now, the chapter also introduces Transactional Analysis, or TA,
Okay.
developed by Eric Byrne.
Right.
And this one kind of delves into some really interesting concepts like ego states.
Oh, yeah.
Can you break that down for us?
So think of ego states as kind of different parts of yourself that take charge in different situations.
Okay.
TA says we've got 3 main ones: parent, adult, and child.
Interesting. So it's not just that we act differently around different people,
Right.
but it's like different parts of us are literally taking the lead.
Exactly. And Brene wrote this popular book, you might have heard of it, Games People Play.
Oh, yeah.
That kind of brought this idea to the mainstream. He suggested we all engage in these psychological games based on our ego states,
Oh, wow.
which can sometimes lead to unhealthy patterns in our relations.
Oh, I can totally see that.
Yeah.
So how does TA help us, break free from those games?
Well, TA emphasizes becoming aware of your ego states
Okay.
and the patterns that you fall into. The goal is to make conscious choices about how you interact rather than just reacting automatically.
Okay.
So it's like instead of your inner child throwing a tantrum,
Yeah.
your adult steps in and says, hey, let's handle this maturely.
Oh, I love that.
It
It's about
is.
taking ownership
Exactly.
of your reactions and making intentional choices.
Yeah.
Okay. So both IPT and TA, they aim to improve relationships,
Right.
but they go about it in different ways.
Yeah.
What I'm curious about is, do we know if these therapies actually work? Is there research to back them up?
Well, that's where things get interesting. IPT has a wealth of research supporting its effectiveness,
Really?
especially when it comes to treating depression. In fact, there's this landmark study, the NIMH Collaborative Treatment Study,
Okay.
that found that IPT was just as effective as medication in treating depression.
Wait, so talking about your problems can be just as powerful as taking medication.
It can be.
Yeah.
That's incredible.
And the great thing about IPT is that it's not just about feeling better.
Right.
It's about functioning better in your relationships, too.
Right.
Research shows that it helps people build stronger obstructions.
Right. Yeah.
which is crucial for long-term well-being.
So it's not a Band-Aid solution. It's about, like, creating lasting change.
Exactly, yeah.
Now, while IPT seems to have a lot of evidence behind it, the chapter does mention some criticisms.
Okay.
So some critics say it's basically CBT in disguise.
Okay.
Others, particularly those from a psychoanalytic perspective,
Right.
they say it kind of oversimplifies the complexities of personality. Well, it's important to consider those criticisms.
Yeah.
You know, when a therapy becomes popular, there are always going to be different perspectives on its validity. It's like anything else.
Right.
There's no one-size-fits-all approach to therapy.
Totally. Okay, so we've explored the ins and outs of interpersonal therapies.
Yeah.
But now let's shift gears. Let's dive into something completely different.
All right.
Exposure therapies.
Okay.
The chapter opens this section with a story about Anik.
Okay.
She's a graduate student who went through a really traumatic burglary.
Oh, wow.
Yeah. And her story is a powerful example of how avoiding trauma
Right.
doesn't make it go away.
Great.
So initially she tries to cope on her own.
Okay.
But those symptoms of PTSD, the insomnia,
Right.
anxiety, flashbacks, they just wouldn't let up.
Yeah, it highlights how important it is to actually face those fears.
Yeah, to really confront it head on.
Yeah.
So how do exposure therapies help someone like Anik, who's been through a traumatic experience? So the chapter focuses on two main techniques: prolonged exposure therapy
Okay.
and eye movement desensitization and reprocessing, or EMDR.
Right.
Can you walk us through those a bit?
Yeah, so both prolonged exposure and EMDR involve gradually confronting those feared memories and situations.
Okay.
So it's not about jumping into the deep end,
Right.
right away. It's about slowly exposing yourself to what you're afraid of
Okay.
in a safe and controlled environment.
So prolonged exposure seems pretty straightforward. You gradually face your fears.
Uh-huh.
But EMDR,
Yeah.
it sounds a little more mysterious. What's with the eye movements?
That's where it gets really interesting.
Okay.
EMDR involves these side-to-side eye movements or other forms of bilateral stimulation like tapping
Okay.
or sounds while you're processing those traumatic memories.
Oh, wow.
The theory is that this actually helps your brain reprocess the trauma more effectively.
So it's not just about talking about the trauma.
Right.
It's about engaging your brain in a different way
Yeah,
to help you heal.
exactly.
That's fascinating.
And while we don't fully understand how EMDR works,
Okay.
the research suggests it's incredibly effective
Wow.
for treating PTSD and other anxiety disorders.
That's amazing. It's like we're learning to use our own brains to overcome these challenges.
Yeah, it's pretty cool.
So we've covered two very different approaches to psychotherapy:
Mm-hmm.
interpersonal therapies
Right.
and exposure therapies.
Mm-hmm.
They seem to come from totally different perspectives.
Yeah,
But both have the potential to be incredibly helpful.
definitely.
Now, I'm curious to kind of delve deeper into the research.
Okay. Yeah, it's fascinating how these therapies, approach the idea of personality.
Right.
Exposure therapies, they're more about addressing, the behavioral side of anxiety and trauma, while IPT really delves into those kind of ingrained relationship patterns.
So IPT isn't really saying that, like, we have these fixed personality traits that cause our problems?
Not exactly. IPT recognizes that our early experiences shape us,
Okay.
but it's more interested in how those experiences show up in our current relationships.
Okay.
It's less about labeling yourself as flawed
Right.
and more about understanding, how your interactions might be contributing to your distress.
That's a really interesting distinction. So if someone is struggling with depression, how would IPT kind of explain what's going on?
IPT sees depression as something that happens within a web of relationships.
Okay.
It's kind of a chicken and egg situation. Interpersonal problems can trigger depression,
Right.
and then depression can make those same problems even worse.
Oh, yeah.
So it creates this vicious cycle.
That sounds incredibly difficult to escape.
Yeah.
Can you give us an example of, like, how this might play out?
Sure. Imagine someone who's already vulnerable to depression,
Okay.
maybe because of difficult early relationships.
Right.
Then they experience a major loss, like a death of someone close to them.
Right.
The grief becomes so overwhelming that they withdraw from others,
Okay.
which just isolates them further and fuels the depression.
So it's not just the loss itself,
Right.
but the impact it has on their connections
Exactly.
that contributes to the depression.
And that's where IPT steps in. It focuses on those relationship problems that are either causing or making the depression worse.
And the chapter mentioned 4 main types of interpersonal problems.
Right.
Right. Grief, role disputes, role transitions, and interpersonal deficits.
Exactly.
Okay.
Grief is about coping with loss,
Right.
which, can be the death of a loved one, a breakup, or even losing a job.
Okay.
Role disputes happen when people have conflicting expectations
Right.
within a relationship.
Like Marilyn and Ed, the
Exactly.
couple from the case study.
Right.
They were definitely caught in some role disputes.
Yeah, they were. Role transitions are all about adjusting to changes in life,
Okay.
like getting married, having a baby, retiring, things like that.
Right. Big life changes.
Yeah, and then interpersonal deficits. Yeah.
Describe, the struggles that some people have forming and maintaining healthy relationships.
Okay, so let's say someone decides to try IPT.
Okay.
What can they expect to happen in therapy?
Well, IPT is a short-term therapy, usually like 12 to 16 sessions.
Okay.
It's very present-focused,
Okay.
meaning it's more about improving your current relationships
Right.
than digging into your childhood.
Gotcha. So no lying on the couch and analyzing your dreams?
No, not in my PT.
Okay.
It's more active and structured.
Okay.
There are 3 main phases.
Okay.
The first phase is all about figuring out what the problem area is.
Okay.
And helping the person understand how their depression is connected to their relationships.
So there's a lot of awareness building right from the start.
Yeah, there is. You're starting to see those connections between your mood and your interactions with others.
Okay.
The second phase focuses on actually tackling that specific interpersonal problem.
So it might be, helping someone work through unresolved grief or figuring out how to renegotiate expectations in a relationship.
Okay, what kind of techniques does IPT use to address those problems?
It really depends on the specific issue.
Okay.
For grief, they might use catharsis to help the person release their emotions and process the loss.
Okay.
For role disputes, the focus could be on improving communication skills and finding ways to compromise.
And then there's that third phase, termination.
Yeah.
What happens there?
The termination phase is all about wrapping things up,
Okay.
reviewing the progress that's been made, and helping the person maintain those gains.
Okay.
It's also important to note that IPT is totally open to incorporating medication if it's needed.
So it's not about choosing between therapy and medication.
Right.
It's about finding the right combination for each person.
Exactly. IPT recognizes that medication can be a valuable tool,
Yeah.
especially for managing severe symptoms.
Okay.
It's all about creating a personalized treatment plan.
Now, the chapter also explored transactional analysis, or TA, as another interpersonal therapy.
Right.
And it mentioned this idea of strokes
Oh, yeah.
being a fundamental psychological need. What are strokes in this context?
So think of strokes as those little units of recognition that we all crave.
Okay.
We all need positive attention and connection.
Okay.
TA says these strokes are essential for our psychological well-being.
So even a simple hello or a compliment can be considered a stroke.
Absolutely.
Wow.
And TA focuses on how we exchange these strokes in our interactions,
Okay.
which they call transactions.
Okay.
And these transactions can be healthy and fulfilling, or they can be part of those unhealthy games we talked about earlier.
Right. The chapter mentioned Eric Brain's book, Games People Play,
Yeah.
which explores those games in detail.
Right.
I'm adding that to my reading list for sure.
Yeah, it's a good one.
But how does TA help us change those unhealthy patterns?
Well, TA is all about becoming aware of those games and the underlying beliefs or life positions that drive them.
Okay.
Once you see the pattern, you can start making healthier choices about how you interact.
It's like you're rewriting the script of your relationships.
Exactly.
So both IPT and TA emphasize the importance of relationships and mental health.
Uh-huh.
But do we know which one is more effective?
Well, as we discussed earlier, there's a lot of research supporting IPT,
Right.
especially for depression.
Yeah.
But the research on TA is much more limited. There haven't been enough controlled studies to really say definitively how well it works.
That's a shame. I mean, the concepts are really fascinating.
Yeah.
But without that solid research to back it up,
Right.
it's hard to know for sure how effective it really is.
Yeah, and even though IPT has a strong evidence base, it's not without its critics.
Right.
We touched on some of those criticisms earlier.
Right. Like the idea that it's just CBT in disguise,
Yeah.
or that it oversimplifies personality.
Yeah. What other criticisms are there?
Well, those who lean towards a humanistic perspective might take issue with the focus on analyzing interactions.
Okay.
They might argue that it neglects the importance of understanding the whole person
Right.
and their unique journey of growth.
Yeah. I see their point.
It's not just about dissecting interactions.
Right.
It's about understanding the person within those interactions.
Right.
And what about the cultural perspective?
From a cultural perspective, the criticism might be that IPT doesn't fully address the systemic issues and social injustices that contribute to interpersonal problems.
Okay.
It might be seen as focusing too much on individual relationships
Right.
and not enough on the broader social context.
Right, because factors like poverty,
Yeah,
discrimination,
right.
lack of access to resources can definitely impact mental health and relationships.
Absolutely.
Yeah.
And then there's the integrative perspective,
Okay.
which might critique both IPT and TA for being somewhat superficial
Okay.
and relying too heavily on common language and practical interventions. They might say these approaches don't fully capture the complexity of human experience in the process of change.
So even though IPT is backed by research, there are still valid concerns about its limitations and how it approaches therapy.
Exactly. It's important to consider all of these perspectives and recognize that no single therapy is perfect
Right.
or right for everyone.
That's a great reminder.
Yeah.
So what about the future of these interpersonal therapies?
Okay.
What can we expect to see in the coming years?
Well, the chapter suggests that IPT has a bright future.
Okay.
It's short-term, it's supported by research, it works well with medication, which
Okay.
makes it a really attractive option,
Right.
in our fast-paced world.
Right. It sounds like IPT is expanding beyond just treating depression, too.
It is, yeah. It's being applied to a wider range of issues, including anxiety,
Oh, wow.
eating disorders,
Mm.
even PTSD. It's also being adapted for different groups, like
Oh.
teenagers and older adults, plus with the development of shorter versions,
Right.
like IPTB, which is only 8 sessions long.
Wow.
It's becoming more accessible to people who might not have the time or resources for longer-term therapy.
That's encouraging. But what about TA? Does it have a future?
The chapter paints a less optimistic picture for TA.
Okay.
Its lack of strong research
Okay.
and some of its outdated language have made it less popular over time.
That's too bad. I still think the concepts are valuable,
Yeah,
but I can see how the lack of research might be a barrier.
definitely. It seems like the future of TA might lie in its integration with other therapeutic approaches.
Yeah.
It could be a useful tool for increasing self-awareness and improving communication within the context of other therapies.
So while IPT seems poised for continued growth and expansion,
Yeah.
TA might need to kind of reinvent itself to stay relevant in the world of psychotherapy.
Yeah, that's a great way to put it. Now, the chapter wraps up with an interpersonal analysis of a couple,
Okay.
Mr. and Mrs. C,
Okay.
who are dealing with OCD and marital problems.
Mm.
It's a really interesting example of how these concepts can be applied to real-life situations.
It sounds like a really complex case. What were some of the key takeaways from that analysis?
Well, the analysis suggests that Mrs. C's compulsive hand-washing
Okay.
isn't just about cleanliness.
Okay.
It's a symptom of deeper fears
Okay.
related to intimacy and control.
Right.
Her compulsions are a way of coping with those underlying anxieties.
Yeah, it sounds like her compulsions are her way of, trying to manage those anxieties and feel safe.
Exactly. And the chapter really emphasizes how important it is to address both the OCD symptoms and the relationship dynamics. You can't just treat one without considering the other.
Right. So how would IPT approach a case like this?
Well, IPT would likely focus on helping Mrs. C face her fears, improve communication with her husband, and kind of renegotiate their roles within the relationship. It might involve things like teaching her relaxation techniques to manage the anxiety, communication skills to express her needs, and strategies to challenge those compulsive behaviors.
Okay. And would medication be part of the picture? Would that play a role as well?
Well, IPT is very open to integrating medication when it's appropriate, so it's definitely possible that Mrs. C could benefit from medication to manage her OCD symptoms alongside the interpersonal therapy.
Okay. So it's about tailoring the treatment to fit the individual's needs and using both psychotherapy and medication as kind of tools to help them get better.
That's the key. Yeah, it's not about one-size-fits-all solutions. It's about finding what works best for each person.
Now, I know we've talked a lot about the theories and techniques of these therapies, but I'm really interested in the research. The chapter goes in depth on the effectiveness of IPT and exposure therapies. It's amazing to see how much evidence there is to support their use.
It's incredible how far psychotherapy has come in terms of scientific rigor. We've moved beyond anecdotal evidence and clinical intuition. We now have robust research methods like randomized controlled trials and meta-analyses to really understand what works and for whom.
That's so reassuring to know. It means these therapies aren't just based on speculation, they're grounded in solid data.
Absolutely. And as we've mentioned, the research on IPT is particularly impressive. Multiple meta-analyses, which combine data from many different studies, have consistently shown that IPT is effective for treating a variety of conditions, including depression, bulimia nervosa, and some anxiety disorders.
Yeah, the chapter even highlighted this landmark study called the NIMH Collaborative Treatment Study. What made that study so groundbreaking?
Well, the NIMH study was a game changer because it was one of the first large-scale studies to directly compare different types of psychotherapy. It compared IPT to cognitive therapy, medication, and a placebo.
And what did they find?
The results were pretty amazing. They found that IPT was just as effective as medication in treating depression. That was a huge finding because it really helped solidify IPT's place as an evidence-based treatment.
It's mind-blowing to think that talk therapy can be as effective as medication for something as serious as depression. It really shows the power of psychotherapy.
It really does. And it's not just about reducing symptoms, it's about improving overall functioning. IPT has been shown to improve interpersonal functioning, meaning it can help people build stronger, healthier relationships.
So it's a holistic approach that tackles both the internal distress and the external factors that contribute to it.
Precisely. And another exciting finding is that IPT can be effective as a maintenance treatment, meaning it can help prevent relapse.
That's a big deal. So it's not just about getting better, it's about staying better.
Exactly. And research suggests that combining IPT with medication can be even more effective than either treatment alone, particularly for severe depression.
Yeah, it makes sense you're addressing the problem from both a biological and a psychosocial perspective.
Right, and it's important to note that even brief versions of IPT, like IPTB, which is only 8 sessions long, have shown positive results. This is great news for people who might not have the time or resources for longer-term therapy.
Accessibility is so crucial. Now let's talk about exposure therapies. The chapter discussed prolonged exposure and EMDR and how they can be effective for treating trauma and anxiety.
Yeah, the research on exposure therapies is really compelling, especially for PTSD. Both prolonged exposure and EMDR have consistently been shown to reduce PTSD symptoms and improve quality of life.
It's interesting that both therapies involve confronting those feared memories and situations, but EMDR also incorporates those eye movements or other forms of bilateral stimulation. What's the thinking behind that?
Well, while the exact mechanisms are still being researched, the bilateral stimulation in EMDR is thought to help process traumatic memories more efficiently. Some theories suggest that it helps create a state of relaxation that allows for more adaptive emotional processing.
So it's not just about reliving the trauma, it's about reprocessing it in a way that lessens the emotional impact.
That's the goal, and even though the eye movements might seem a little unconventional, it's important to remember that EMDR is backed by solid research. It's not just some new age gimmick.
It's amazing how much we're learning about the brain and how different techniques can influence its functioning.
It truly is an exciting time for neuroscience and psychotherapy. And as research continues, we'll undoubtedly gain even deeper insights into how these therapies work and how to make them even more effective.
Well, this deep dive has been a whirlwind tour of 2 major branches of psychotherapy. We've unpacked the theories, the techniques, the research, and even peeked into some real-life cases. I feel like I've learned so much.
Yeah, it's been a fascinating exploration, hasn't it? And I hope it sparks some curiosity for our listener. Perhaps it's given them a new understanding of how relationships and trauma can impact mental health.
Exactly. Maybe they'll even feel empowered to explore some of these approaches for their own personal growth and healing. After all, that's what it's all about. Thanks for joining us for this deep dive into the world of psychotherapy. We'll see you next time.